Dr. Gupta, typically, how often should a person the president's age go in for a checkup?
Anna, good morning. Usually you do a checkup, physical exam at least once a year. If there are other concerns, chronic conditions that are being monitored, it can be much more frequent. And so the fact that we're getting three in a 12-month span, not entirely clear. And I would say that everything that Kayla just pointed out, these visible physical signs that we've seen recently attributable to non-credible reasons, the fact that he has bruising on his hand to aspirin and frequent handshaking, lower extremity swelling that they didn't even note on his last physical exam readout in 2025, claiming it's chronic venous insufficiency now, doesn't make a lot of sense. The rash discoloration on his neck. There's a lot of physical signs here beyond just his fatigue that warrant discussion and explanation.
Well, we know the president had a CT scan at his last visit in October, although they didn't disclose that immediately. He was diagnosed with chronic venous insufficiency last summer, and in a colonoscopy in July, Trump had a diverticulosis and a benign polyp diagnosis. Is there any of this that would be cause for major concern?
From what you just said, no, none of those conditions in and of itself. But I think the broader concern here are twofold. One, will his doctors be honest, or Anna, will they continue to editorialize? We didn't know, they didn't even know that he had a CT scan. They claimed initially, and they even put out a memo saying he had an MRI. And then the president on Air Force One had to say, no, he had a CT scan. How does a physician, especially the physician to the president, not know what advanced imaging their patient is getting? So that, number one. Number two, they last time back in October, they put out a highly skeptical readout of his physique, claiming that he had an NFL linebacker's physique, 6'3", about 220. Hard to believe, not credible. And then also sweeping statements on his lab values and his imaging, saying that they're quote unquote astonishingly good in the past. These are not normal descriptors or readouts of what a physician typically would use when describing their patient's health. So will they stop editorializing and just be honest and provide real data? We'll see. But right now, it's been very questionable what they've put out. And two, I would just say his executive functioning. He keeps citing this Montreal cognitive assessment tool at every political rally.
He says he aces those tests.
He says he aces those tests, exactly. And that is not a marker. That's not what we utilize to assess one's executive functioning. Are they able to plan, think under pressure, make decisions under pressure? Do they have impulse control? These are what we analyze with finer tools, neurologic tools, to assess executive functioning, not this scrappy tool that he keeps citing. And by the way, you don't get that tool assessed every month or every few weeks. He seemingly claims that he gets this done on the regular. That doesn't make any sense unless his doctors are actually monitoring for a neurologic condition. So there's a lot of inconsistencies here, but I am not confident we're going to get honest, non-editorialized medical information today, because that's not been in keeping with the pattern of his physicians.
Well, we'll keep on it. We'll keep asking the questions, and Dr. You'll help bring us the truth and what we need to know. Dr. Vin Gupta, as always, thanks for being here.